Welcome to Medicare Auditing in 2025, What Providers Need to Know, where we break down the latest trends in healthcare billing and compliance. I'm Laura Lee Kapp, and today we are diving into an important topic for healthcare providers, Medicare Auditing 2025. With increased oversight, stricter compliance rules, and AI-driven audits, it is crucial for providers to stay ahead of the curve to avoid penalties and ensure accurate reimbursement. So what's changing and how can providers prepare? Let's get into it. Segment 1. Why are Medicare audits intensifying? Medicare audits are designed to detect fraud, waste, and abuse while ensuring that providers follow billing regulations and documentation requirements. In 2025, audits are becoming more rigorous due to three major components: the increased use of AI and data analytics for detecting irregular billing patterns, stricter compliance requirements, particularly for telehealth services, and greater scrutiny of high-cost services and Medicare Advantage plans. Understanding these changes is crucial for avoiding claim denials and financial repercussions. Segment 2 is key trends in shaping Medicare audits. 1 is AI and data analytics and auditing. Artificial intelligence is revolutionizing Medicare audits. AI tools can quickly analyze claims, data, and flag potential billing errors or fraud. According to the industry reports, AI in healthcare audits is expected to grow at nearly 10% per year through 2031. This means audits will become more data-driven, leaving little room for error. Second, telehealth is under this microscope. The pandemic led to a boom in telehealth, but with its widespread adoption comes stricter Medicare audits. Providers must ensure that telehealth visits are properly documented, just like in-person consultations, to comply with Medicare guidelines. Third, high-cost services face more scrutiny. Surgeries, specialty treatments, and long-term care services are high reimbursement areas, making them prime targets for audits. Providers must justify the medical necessity of these services with comprehensive documentation. Fourth, increased oversight for Medicare Advantage plans. Medicare Advantage plans, which offer alternatives to traditional Medicare, will undergo more audits focused on risk adjustment coding and accurate documentation of diagnosis that affect reimbursement rates. Compliance is key to avoiding penalties. Segment 3 is how to successfully navigate Medicare audits. So, what can providers do to stay compliant and avoid costly penalties? Here are 4 essential steps. Ensure accurate documentation. AI-driven audits leave little room for errors. Telehealth services in particular must be thoroughly documented, including patient history, treatment plans, and follow-up care. Justify medical necessity. High-cost services must be well documented, detailing patient diagnosis, procedures performed, and clinical necessity. Stay up to date on Medicare regulations. With Medicare rules constantly evolving, providers must stay informed through training, CMS updates, and internal policy reviews, and conduct internal audits. Regular internal audits help identify potential compliance risks before an external audit does, ensuring claims are accurate and properly coded. Segment 4 is leveraging expertise to reduce audit risk. To help providers navigate audits, Medicare has programs like the Targeted Probe and Educate TPE initiative, where contractors work directly with providers to identify errors and improve compliance. Additionally, CMS offers training resources to help providers avoid common billing mistakes. Partnering with a compliance specialist or medical billing companies can also be beneficial. These experts ensure documentation is thorough and accurate, helping providers submit clean claims and minimize audit risks. In closing, as Medicare audits become more rigorous in 2025, healthcare providers must take a proactive approach to compliance by staying informed, improving documentation, and seeking expert guidance. Providers can avoid costly penalties and ensure financial stability. That's all for today's episode. If you found this information useful, be sure to subscribe and share the podcast with your colleagues. For more insights on healthcare compliance and billing, stay tuned for our next episode. Thank you for listening.